The Cochrane Collaboration is an independent, non-profit, non-governmental organization consisting of a group of more than 31,000 volunteers in more than 120 countries. The collaboration was formed to organize medical research information in a systematic way to facilitate the choices that health professionals, patients, policymakers, and others face in health interventions according to the principles of evidence-based medicine. The group conducts systematic reviews of randomized controlled trials of healthcare interventions, which it publishes in the Cochrane Library. A few reviews, in fields such as occupational health, have also studied the results of non-randomized observational studies. The collaboration formed an official relationship in January 2011 with the World Health Organization as a partner non-governmental organization with a seat on the World Health Assembly to provide input into WHO resolutions. History. The Cochrane Collaboration was founded in 1993 under the leadership of E. Chalmers. It was developed in response to Archie Cochrane's call for up-to-date, systematic reviews of all relevant randomized controlled trials of healthcare. Cochrane's suggestion that the methods used to prepare and maintain reviews of controlled trials in pregnancy and childbirth should be applied more widely was taken up by the Research and Development Programme, initiated to support the United Kingdom's National Health Service. Through the NHS R&D program, led by the first Director of Research and Development Professor Michael Peckham. Funds were provided to establish a Cochrane Centre to collaborate with others in the UK and elsewhere to facilitate systematic reviews of randomized controlled trials across all areas of healthcare. In October 1995, the collaboration formed the Cochrane Consumer Network to incorporate patient perspectives into the review process. Shortly thereafter, new, plain language summaries provided users with a jargon-free synopsis of each systematic review. The Cochrane Collaboration is currently concentrating on capacity building in health research as individuals, groups, and institutions and LMICs. Logo. The logo of the Cochrane Collaboration illustrates a meta-analysis of data from 7 randomized controlled trials, RCTs, comparing one healthcare treatment with a placebo in a forest plot. The diagram shows the results of a systematic review and meta-analysis on an expensive course of corticosteroid given to women about to give birth too early. The evidence on effectiveness that would have been revealed had the available RCTs been reviewed systematically a decade earlier. This treatment reduces the odds of the babies of such women dying from the complications of immaturity by 30–50%. Because no systematic review of these trials had been published until 1989, most obstetricians had not realized that the treatment was so effective, and therefore many premature babies have probably suffered or died unnecessarily. Reception. An editorial in the Canadian Medical Association Journal in 2004 noted that Cochrane reviews appear to be more updated and of better quality than other reviews, and due to their standardized methodologies, was the best single resource for methodologic research and for developing the science of meta-epidemiology. Their work has also led to methodological improvements in the medical literature. However, the editorial also noted areas for improvement remained, including adequately assessing potential harms from medical interventions and providing a more user-friendly format as well as promoting international collaboration. South Asian Cochrane Network and Centre. The South Asian Cochrane Network and Centre, SASIANCC, is a part of the global network of Cochrane Collaboration and is located at the Christian Medical College, Vellore, India. The centre, originally the South Asian Cochrane Centre, was established in January 2004 as a branch of the Australasian Cochrane Centre, with geographical responsibility for South Asia, Afghanistan, Bangladesh, Bhutan, India, Sri Lanka, Pakistan, the Maldives and Nepal. SASIANCC is hosted by the Prof. Hoshainam V. Moses Center for Evidence-Informed Healthcare at the Carmen Block at the Christian Medical College, CMC, Campus, Peckham, Valour since December 2004, in memory of the late Prof. Hoshainam Kumar Moses, at the suggestion of his MBBS colleagues, who also donated funds towards establishing the center, with the aim of increasing the uptake of reliable and locally relevant evidence to inform health decisions and to coordinate the activities of the South Asian Cochrane Network. In July 2008 it was redesignated as an independent center of the Cochrane Collaboration, with a coordinating center at the Christian Medical College, Valour, in India, and 5 network sites in India, 2 in Pakistan, 1 in Sri Lanka, and 1 in Bangladesh. Its projects have included the National Snakebite Survey in India, the South Asian Toxicology Network, the Cochrane Student Journal Club, and the South Asian Database of Controlled Clinical Trials. United States Cochrane Centre. The United States Cochrane Centre, USCC, was established in December 2002 and operates out of 3 offices. The main office is headquartered at the Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. The USCC is dedicated to promoting awareness of the Cochrane Collaboration and its objectives and access to the Cochrane Library in the United States. The USCC main office in Baltimore is responsible for, among other things, providing training and support for review authors, trial search coordinators, review group coordinators, editors, hand searchers, consumers, and others. A special function of the USCC is to support Consumers United for Evidence-Based Healthcare, Q, a partnership with health and consumer advocacy organizations interested in integrating understanding and interpretation of evidence-based healthcare into their advocacy activities, strengthening the voice of consumers in healthcare research, and providing leadership in these areas. From 1994 to 2005, the USCC coordinated development of the Cochrane Central Register of Controlled Trials, Central, a source of reports of controlled clinical trials worldwide, a master list of journals being searched, and hand searcher training. The San Francisco branch of the U.S. Cochrane Centre operates out of the University of California, San Francisco, and develops and evaluates systems for assessing and sustaining the quality of Cochrane reviews. The Caribbean branch of the USCC was launched in June 2013 and is the reference center for English-speaking Caribbean territories. The branch is housed at the University of the West Indies in Mona, Jamaica. Campbell and Cochrane Equity Methods Group. The Campbell and Cochrane Equity Methods is co-registered with the Cochrane Collaboration and the Campbell Collaboration. It is based at the London School of Hygiene and Tropical Medicine and the University of Ottawa. The group encourages authors of Campbell and Cochrane systematic reviews to consider the effect of the interventions on the disadvantaged or their ability to reduce inequities in health. The group provides guidance to authors who want to incorporate equity into their reviews and has developed tools for planning, conducting, and reporting these systematic reviews. Cochrane Acute Respiratory Infections Group. The Cochrane Acute Respiratory Infections Group is registered since 1994. Its editorial base is currently located in the Bonn University in Australia. The group deals with healthcare interventions aimed at prevention, treatment, and rehabilitation aspects of acute respiratory infections including diphtheria, meningitis, measles, and chickenpox. About 175 systematic reviews have been conducted under its purview. Cochrane Eyes and Vision Group. The Cochrane Eyes and Vision Group has been registered with the Cochrane Collaboration since 1997. Its editorial base is currently located at the London School of Hygiene and Tropical Medicine in London, England, with a satellite group at the Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. The group prepares systematic reviews of all the interventions used to prevent or treat eye diseases and/or visual impairment. Additionally, the group considers the evidence for interventions that aim to help people adjust to visual impairment or blindness. Cochrane Musculoskeletal Group. The Cochrane Musculoskeletal Group has been registered with the Cochrane Collaboration since 1993. Its editorial base is currently located at the University of Ottawa in Canada, with satellite groups at Cochrane Institute, Melbourne, Australia, at the University of Alabama at Birmingham, United States, and at the Hôpital Hôtel Dieu de Paris, Université Paris Descartes, France. The group prepares up-to-date reviews for the treatment, prevention, or rehabilitation of musculoskeletal disorders. Additionally, also provides secondary products to make the evidence more friendly for those involved in treatments for musculoskeletal diseases. Cochrane Occupational Health and Safety Review Group. The Occupational Health and Safety, OSH, Review Group is one of the 53 review groups in the Cochrane Collaboration. The OSH Group publishes reviews of the effectiveness of interventions to reduce occupational diseases, injuries, and disability. Currently there are 126 review OSH-related topics in the Cochrane Library. The editorial base is located in Kuopio, Finland, and funded by the Finnish Institute of Occupational Health.